Welcome in, folks. It's time for some 814 Your Health, sponsored by Penn State Health Medical Group. Joining me today is Dr. Amy Hayes, who is a family medical physician at Penn State Health and is also an associate professor of family and community medicine. Dr. Hayes, thank you so much for joining us.
Thank you. Thank you for having me.
So this is a topic that I think is perfect for this time of year. We're all starting to feel it in our eyes, in our noses, a little bit in our throats maybe sometimes, but allergy season is upon us. Dr. Hayes, tell us, how do people get allergies, and what are some of the common symptoms that people have?
So we know that over 50% of people have allergies, so it's extremely common. I have them myself, so I can sympathize with others who suffer from the same thing. As far as how do they get them, people become sensitized to things in their environment, whether that be pollen, medications, foods. Why people get them, we're not really sure. We do know that it tends to run in families. So if other family members have allergies, you're much more likely to have them yourself. And we do know that we live in a very high pollen area. There's a term called the pollen belt, which encompasses parts of Ohio, Pennsylvania, and New York. So we're right in the heart of it.
Yeah, I definitely, I know we have coworkers that are starting to feel it already. And I know I take an allergy pill. My mom actually is allergic to cats, except she has 4 cats. So how does that help? So I guess my next question is, we're kind of in a very highly sensitized time. We're all thinking about, well, oh, I got the sniffles. What does that mean? Oh, I got my ear starting to twitch. What does that mean? And some people, I think recently, have kind of been mistaking some of their allergy symptoms as possible COVID symptoms. How can people tell the difference?
It can be hard sometimes to tell the difference between allergies, colds, sinus infections, or COVID. There's the common symptoms that we all think about, like runny nose, stuffy nose, itchy, watery eyes, sneezing. Those are more typical of allergies, but can occur with the other illnesses that we talked about too. If someone has a fever, then that makes it much more likely to be an infectious cause, such as a cold, COVID, or a sinus infection, rather than allergies. But there's a lot of other allergy symptoms that people don't associate necessarily. Things like sinus pressure, sore throat, hoarse voice, these can all be signs of an allergy. And if you have a stuffy nose, you can lose your sense of smell, which affects your sense of taste. So you can't always hang your hat on a loss of sense of taste or smell being associated with COVID. I think really it comes down, if you're not sure, call your healthcare provider. They may decide to do a telehealth visit. They may want to do an in-person visit, or they may recommend COVID testing.
What are some of the common treatments for an allergy? I know I mentioned an allergy pill, but I think there's sprays and things like that. What are some of the common things that you kind of work with?
Sure. So antihistamines, which are what people are talking about mostly when they say an allergy pill, are medicines like Claritin, Allegra, Zyrtec, Benadryl. They help some of the symptoms of allergies, but they don't really give long-term relief, and you have to keep taking them in order to get relief. So if someone has mild, occasional allergy symptoms, these medicines are appropriate. For more persistent allergy symptoms, medicines like the nose sprays, Flonase, Nasacort, Flonase Sensimist are probably going to give better relief. However, they have to be used on a very consistent basis every single day for relatively long periods of time. Some people get relief with medicines like decongestants, which just help relieve the pressure and the congestion of your nose. Some other people also may use sinus rinses, such as the neti pot, or medicines like saline nasal spray, just again to give them help from the symptoms of allergies. If those products are not doing the job, there are stronger prescription medicines. For instance, one called Singular that is taken by tablet every day. And of course, if those things still are not giving relief, some people will decide to do allergy shots.
So if people are maybe experiencing some symptoms, they might say, "Hey, I'm going to go get an allergy test." Is that
Mhm.
important to do to get an allergy test to see what you're allergic to?
No, not really. For most people, it's much easier to just try allergy treatments than to proceed with allergy testing because the reality is most people who are allergic to things are allergic to many, many, many things. So knowing what you're allergic to does not allow you to avoid those things. We can't avoid pollen, we can't avoid molds and dust mites in most cases. So knowing what you're allergic to is not necessarily that helpful unless you're at the point where you're ready to proceed with allergy shots. You've tried all the other medicines, they're not working. At that point, you may be referred to an allergist who can perform allergy testing, and they use the results of that to develop the serum that they give you in the allergy shots.
Yeah, because I mean, it's as you said, 50% of Americans are dealing with some type of allergy
Hmm.
symptom, and dust, grass, things like that are things
Hmm.
you probably aren't able to avoid.
No, no. I mean, you can minimize your exposure, but you really can't avoid them entirely.
Exactly. Dr. Hayes, I want to thank you so much for taking the time and being with us
Hmm.
today. I want to remind the folks, if you'd like to set up an appointment or find some care with family medical doctors, you can go to pshcc.org/familymeddocs. Or if you want to see what Penn State Health offers in all types of care, pshcc.org/care. Dr. Hayes, thank you so much.
Thank you.
Folks, we have much more still to come in the show today. Stay with us.
Studio